Well, I think it's crucial, actually. It's fundamental to what we need to do. If you look at what's driving health inequalities in Canada through research, through communicating with focus groups, much of it is contingent on social determinants of health and looking at structural determinants, which really have to be addressed through health and all policies approaches or all of government approaches. There's so much of what we do already depends on collaboration and partnership as an approach. And so it really lends itself to intersectoral collaboration to get those kinds of policy changes happening. So I think it comes down to what public health's role is in achieving or building, improving health equity. Health and all policies is one of the main tools or levers we should be using. There are things that we can be doing in Canada, in Canadian public health, to get better at that at all levels, local, provincial, and federal. But it starts with that emphasis on collaboration, partnership, coalition building, that kind of work. I'd have to say that one of the things I've seen as a innovation in local public health has been starting to reorient our health promotion activities toward movements on improving structural determinants and less of a secondary focus on health behaviors, because so much is predicated on improving those conditions in which people live and creating those supportive environments and of course, building healthy public policy. The other strengths that we have in public health around health surveillance and monitoring activities ties into the health equity and health and all policies as well, because what we've started seeing is a change in health status reporting where there's a health equity overlay or a stratification. It inevitably leads to a discussion around why. Why are we seeing differential health outcomes in different subpopulations? An analysis of intersectional issues that might be driving it. And increasingly, I find as we present that data to intersectoral partners, we start moving from those complex issues just being put to the side or put on the parking lot to bringing them front and center and realizing that by collaborating together, we can perhaps change some of those conditions that are leading to those inequities. So I think it's pretty fundamental, I would have to say, and really needs to be something that we're focused on a lot more. Another issue potentially around this interface between health and all policies and improving health equity has to do with our responses to improving health equity are both focused at the public health service level on the one hand, the health system level, and also then to our intersectoral partners. So it starts looking at how we deliver our programs and services, and are we having the same kind of impact and reach to subpopulations that are impacted by different social determinants of health. So how is it our programs are being taken up by those living in poverty or those from different cultural backgrounds or those with different levels of education, et cetera. As we do that, we can adapt our own programs and services to achieve better health equity. But it starts giving us an insight around what the challenges are from other sectors. And that then leads to dialogue, say, with the health system and recognizing we can play an advocacy role in changing health policy to be more equitable. Even incorporating a health equity lens into our quality improvement work in the health system starts to get at the health system thinking through the fact that people are coming with different needs. And then the health system too can start interfacing with other sectors to not just change how they give advice around medications people want to use or following medical advice, but recognizing it's more difficult to follow medical advice if you're coming from some of these, speaking a different language or not having as many resources to draw upon. So that can help us then improve our health services as well. But at the same time, we're getting educated around what those, what's driving those needs it prepares both public health and the health system then to start working with other sectors, because we can start to see how it's impacting their health and access to care. So then lastly, the intersectoral nature, then as we provide the evidence we're seeing from the health side and start contributing to an intersectoral dialogue around improving programs and services, it's not so much seen as health telling education what to do. It's health and education recognizing there's a complex, wicked problem we're trying to solve, and it might need policy change on all fronts to be more joined up and working toward the specific needs of these various subpopulations. So like it really has just become another health promotion tool that we need to be using to improve health equity.